Hello and welcome to Hop app demo. In this demo, we will first cover the role of a trainee. A trainee is someone who is new to your agency, and this trainee is going to go through 3 work tracks. They will watch content, they will have a preceptor with whom they will do field visits, and they will get their orientation competencies checked off. So first, let's go over the course content. The content of the app can be arranged as per agency's preference or based on discipline and or number of years of home health experience. So there are 3 type of clinicians you're onboarding. I will use the example of nursing. So there are 3 type of nurses. The first one is a nurse that has been a home health nurse and is now switching agencies. For this nurse, you can have a pre-test. So as soon as this clinician will first hop on the app, they will open course content, they will go through an assessment. All the aspects where the clinician has done well, they will not have to watch that content. And all the aspects they have not done well in, only that content will be made available. And then your second type of nurse is a nurse who has been a nurse and is now coming in and trying home health or want to switch fields and want to come into home health. For this nurse, the content is divided into phases, and these are digestible phases with digestible modules because we want all of the content to be systematically organized because there is so much content to cover. Here we have divided content in 19 phases and 67 modules. For each phase, all of the content must be watched at least 80%, and a clinician must pass the assessment by at least 80% in order for the next phase to be opened or made available. Okay, and the reason we have picked 80% is because that is what the CMS requirement is for passing any of the home health testing. As you can see, all of the content is very well organized. You have access to the app and you can go through all of the content at your own pace. Next, we have field visits. Field visits are your preceptor visits. Here, your agency can dictate, and these are very fluid, your agency can dictate what your preceptors must teach your newly hired clinicians when they're out in the field. So this is based on visit type and discipline. Here we have start of care, follow-up, resumption of care, and discharge visit for nursing profession. Let's suppose I perform a resumption of care visit. I perform 2 resumption of care visits with a preceptor. And here I observed the preceptor, obtained schedule for the day. I assisted the preceptor with medication reconciliation, and I was able to independently perform the dyspnea and the pain assessment. And now I will submit what I observed with the preceptor, and all of this work that I've done is now going to show up on my preceptor's dashboard. And then the third workflow is your field competencies or your orientation competencies. For your orientation competencies, I've divided them in phases, phase 1, 2, and 3, but they are available. You can go to phase 3 competencies and you can, for example, here you want to get your RN, LPN, wound vac checked off. If I have any question, I can submit them. And now this competency will again show up on my preceptor's dashboard. Now let's go over the calendar functionality. The calendar functionality can be used to see what the clinician has been up to in a snapshot. Here you can see on the 25th, the clinician completed some competencies or submitted competencies. They went on field visits. And on the 26th, they have an assignment for modules. And then on the 29th, they have one-on-one. This one-on-one is repeated every week for over 5 weeks. And maybe that is what the touch point is that is defined by your agency. That when a clinician is onboarded, they're going to get a one-on-one for next 5 weeks every week. So yeah, it helps you sort of see what the clinician has been up to. They can take a snapshot of it and share it with their educator, with their preceptor, with their clinical manager. It just makes it easier for everyone to be on the same page. And your agency can define what these notifications should be. We have kept the role of a trainee very simple. The app is very easy to use, self explanatory, and at all points, everyone is aware of where the trainee is. And if they need encouragement, the app allows those points or those encouragements to occur within the app and keeps everyone on the same page.